I'm pleased to be joined today on Health Beat by Dr. Michael Woodbury, orthopedic surgeon with Faith Regional Physician Services Orthopedics in Norfolk. And we're talking about joint replacement revision. And Dr. Woodbury, why may someone need this type of surgery, and what does this process look like?
Most commonly, people need this because of the piece of plastic that is in between the metal hard surfaces of either a hip or a knee gets worn out. Generally speaking, that lasts about 15 to 20 years. When that gets worn out, people have pain, they have instability, either they feel like their hip clicks or their knee doesn't feel the same. Sure. How we evaluate that is with some x-rays. Just plain simple x-rays can show us if the joint space is being worn thin, if the ball is moved anywhere in the socket of the hip, and if the other metal parts are holding up very well. If they're holding up well, it's a straightforward procedure of just taking out the plastic and putting in a new piece of plastic. Old operative reports are always beneficial with that. And we try to get those so that we can match the implants and make sure that we're getting a good fit and everything's locking together. We always want to rule out infection as a cause for why they're having pain. So once that's been ruled out, it's a fairly straightforward process after that, where we talk about the procedure, how long it'll take, what the recovery will be like. The other thing about the procedure that's important to understand is that it takes a little bit longer to recover than it does from the first surgery. And that recovery is because of getting the old piece of plastic out safely. It requires more tissue dissection, and then it takes a little bit longer surgically to get that out. But that soft tissue is really what is the pain after the surgery that needs to get better. And patients generally can get better very quickly, although a little bit longer than it would take for the first surgery.
That's interesting, because I would have never thought that that would actually happen, that you could put pieces out, put pieces back in.
It is what makes it a fairly straightforward procedure.
Sure.
From the surgeon standpoint, although the recovery is just as much from a patient standpoint.
Well, thanks for sharing that with our viewers. We appreciate it. Thank you. And that's Health Beat, brought to you by Faith Regional Physician Services.